We are going to talk about the heart and the basic functions of the heart, so be sure you're taking notes. Give this just a second. It's loading. I'm sorry, our internet's a little bit slow today. So be sure that, like I said, you take a few notes because you will have a test over this. Try to learn the chambers of the heart and the major vessels, and we'll talk about those. And we'll talk about the function of the heart. Let me try this again. See if it's gonna figure out what's going on. I mean, try to reopen it, okay? Like I said, I'm sorry it's so slow. It's our internet today. Um, y'all know, I'm sure y'all know for sure that at times it has really everybody has it gets really slow. So you guys be sure that, like I said, you're taking notes, trying to learn this information as we go. We will have a test over the entire cardiovascular system, probably close to the end of next week. Well, it is really, really loading slow. Good grief. I'm sorry, guys. There aren't a ton of slides, and they don't even have tons of pictures. It's just for you today. Okay, let's see if it'll load better this time. Or maybe a little bit faster. I don't know. There we go. So we're going to talk about the basic anatomy and functions of the heart. So we're going to learn about all the parts of our cardiovascular system. We're going to learn about the heart itself. We're going to learn about the vessels, the arteries, and the veins, and we're going to learn about some about blood itself. So the function of our heart, it is our transport system. It takes oxygen and nutrients to all of our cells, and it brings waste back like carbon dioxide. Some of it's filtered out in the kidneys and liver as it comes back. And our body needs hormones for all of its functions. So it carries all those things around via the blood, and then as it comes back, it's reoxygenated. We get rid of carbon dioxide in it, and other, like I said, through the kidneys, the liver, and the lungs, we get rid of other things that our body doesn't need and can't break down on its own. So it's our transport system. And when we talk about the heart itself, it is responsible for that pumping action to get blood to all of our cells and through the veins and arteries, and bringing it back to get rid of all of the waste. So the outermost part of the heart, remember that there are 3 layers of the heart. So with cardiac tissue, there are 3 layers of cardiac tissue in the heart. The outermost layer is the pericardium. Peri means around, and cardi means heart, and means pertaining to. So it is the membrane around the outside of the heart is the pericardium. And it anchors the heart to the diaphragm and the sternum. The diaphragm is a membrane that runs the lower part of the lungs that helps the lungs expand and retract when we breathe. And the sternum is the breastbone. In the middle of the chest. The pericardium secretes serous fluid so that when the epicardium and pericardium, they're kind of the epicardium or the pericardium or the epicardium That way it doesn't have friction with the myocardium. And when we think about myocardium, that middle layer, that's actual heart muscle. So that is where, in the middle of our heart, that's where our actual heart muscle is. And it's that contractile, it's the part that makes our heart contract and relax. It's what our ventricles and our atria are made of. And then the innermost, or the endocardium, endo means inside the heart. That's what lines the chambers of the heart. And we have 4 chambers. So remember, pericardium, epicardium, that is the outermost layer of the heart. And it has serous fluid to keep it from, that membrane from sticking to myocardium. Myocardium is the middle of the heart. And that's the actual heart muscle. And the endocardium is that inner lining of the heart muscle. That's where the blood pumps, and it lines each chamber of the heart. So as you can see there's that fibrous pericardium there on the outside. When we take that layer back, we can see the pericardial sac over there on the side. And that visceral part of the pericardium, that's the epicardium. So we have that, it's 2 layers together. We have a kind of like a thin layer, the pericardium on the outside right underneath it, and it does attach to it. So it's 2 layers, but they are joined for the endocardium. And then if we shaved that down, we would see the myocardium, and then if we actually dissected that heart on the inside, we could see the endocardium. Oops, sorry guys. Well, I'm frozen. Okay, go all the way back. There we go. So right there, you're getting to see that's moved out the very inside layer, which is the part that would touch the inside of the heart. That would be the epicardium. Then you're seeing that middle part, which is the myocardium, that part. And you're seeing the pericardium on the outside, and that second layer would be the epicardium. Now, if you remember that the heart is only, our entire body has roads and roads and roads of vessels. They start from at the top of the heart there. You see the aortic arch, that little rounded area at the top of the heart, the aortic arch, and the 3 vessels that branch from that. And on the back, you see the vena cava. Those are our very large vessels. And they branch out to the rest of the body from there. But our heart itself only has coronary arteries and veins. So what you're seeing in that section is one of the coronary arteries, that vessel that runs there. And that is all we have that keeps our heart vascular, that gets oxygen and nutrients to the heart itself. That's the only vascular supply that we have. So when one of those gets clogged, that's how people end up having a heart attack, due to either a clot or plaque buildup from fatty material or other things, other waste materials that collect there. And so that's when people end up having a heart attack, is when those get clogged and we don't get blood supply to a certain section of the heart, and it actually dies. Okay, so let's talk about the chambers of the heart. The heart has 4 chambers. Remember that the heart has 4 chambers. The top 2 chambers are the atria, the right and left atria. And then we have 2 ventricles that are the right and left ventricle. Blood comes in. So when blood comes into the heart, it comes in on the right side. The right side of the heart, and remember this, the right side of the heart has deoxygenated blood. That's blood that's coming back, that's already been used and it goes into the veins, from the veins into the vena cava, the inferior superior vena cava, and then it goes into the heart through the right atrium, and then it goes down to the right ventricle. Once it leaves the right ventricle, it goes to the lungs. Now, when it leaves the lungs, it's actually leaving the lungs in the pulmonary artery. and it comes back to the left side of the heart. The left side of the heart has oxygenated blood. The lungs oxygenate the blood at the when we breathe in, and it sends that blood back to the left side of the heart, where it comes into the right atrium, goes down to the right ventricle, and then it pumps it out through the aorta, which is our largest vessel. And when we talk about vessels, we'll talk about that a little more. But remember that the right side of the heart is deoxygenated blood. It means that it's coming back when our cell with carbon dioxide, and it's coming back with other waste material for the lungs to get rid of, some bicarbonate that we couldn't use all of. And then when it comes back from the lungs, from the pulmonary veins, it goes into the left side of the heart, which pumps oxygenated blood, because the lungs have oxygenated it, pumps it back out to the rest of the body. Those two chambers are separated by a thick septum, and it's a thick line of myocardium that keeps the chamber separate. And we have valves that keep blood from backflowing, either backflowing from the atrium, from the ventricle to the atrium, from the vena cava to the right atrium, or from the pulmonary veins and arteries. So it keeps we have valves in the heart that keep them blood from backflowing. But remember, you have two atria and two ventricles, and the right side of the heart has deoxygenated blood, or blood that needs oxygen, and the left side of the heart has oxygenated blood. So if we look here, you can see on the right side of the heart, so remember, you've got a right atrium, and blood goes through the tricuspid valve. That keeps blood from coming up from the right ventricle when the heart pumps. Goes from the right ventricle to the pulmonary veins. When it goes from it goes out the pulmonary veins to the heart, comes back in through the pulmonary artery, goes down into the left ventricle, and down into left atria, down into the left ventricle, and out to the rest of the heart. So you're seeing all of the parts of the heart. I want you guys to remember where the right atria, the right ventricle, the tricuspid, and the mitral valve are, along with the left atria and the left ventricle. Know where the aorta and the superior vena cava are. I will most likely give you an image on the test that is similar to the one you're seeing here, for you to label parts of that heart. So you have a right and a left atria, and you have a right and a left ventricle. Then there's that septum, that thick piece of myocardium or heart muscle that separates the right and left sides of the heart. You're seeing where the heart is actually located in the body. And if you notice, your heart's about the size of your fist, and it sits kind of at an angle. And it sits where the right atria is pointed to the right side of your heart, and the septum, or the point of the heart, is pointed over towards the left lung. So remember, like I said, deoxygenated blood is on the right side of the heart, and it goes to the lungs, and it comes back, oxygenated blood, into the left side of the heart, and then it goes out to the rest of the body. Okay, so our pulmonary circulation. This is something that I kind of have talked about, but remember the pathway for pulmonary circulation. Remember, deoxygenated blood comes into the right side of the heart from the inferior and superior vena cava. Those were those large blue vessels you saw a while ago at the back of the heart. It goes into the right atrium, into the tricuspid valve, then through the tricuspid valve, down to the right ventricle, out through the pulmonary semilunar valve, or the pulmonary valve, to the left pulmonary artery, and then to the lungs. So once it gets to the lungs, that's when we breathe out, and then we breathe back in and oxygenate that blood. Once we oxygenate that blood, it comes back in from the lungs through the pulmonary vein, into the left atrium, down to the left ventricle, and out to the aorta, to the rest of the body. So there's your tricuspid valve, and then there's your pulmonary valve, Now, this talks about this goes over again what oxygenated blood does. How oxygenated blood comes into the left side of the heart from the pulmonary vein into the left atrium through the bicuspid or the mitral valve, down into the left ventricle, then through the aortic valve, up to the aorta and out to the rest of the body. You guys will need to know those pathways, the deoxygenated and oxygenated blood pathway. What happens on the right side of the heart, what happens on the left side of the heart. And there we go again. There's the mitral or bicuspid valve, and there's your aortic valve. This is just another image that shows you how blood oxygenates in the pulmonary circuit and then out to the rest of the body. So once again, deoxygenated blood is on the right side, and it is those blue vessels. Those are the veins. That is where carbon dioxide oxygen has been left off at the cellular level and at the tissue level, and it's picked up that carbon dioxide. It's bringing it back up to the right from all the rest of the body up to the inferior superior vena cava, into the right atrium, through the tricuspid valve, into the right ventricle. Goes from the right ventricle to the right pulmonary artery. Then it goes to the lungs up there at the top. Carbon dioxide is breathed out. Oxygen is breathed in. It comes back through the pulmonary vein into the left atrium, down to the left ventricle, up to the aorta, and out to the rest of the body. So that image is showing you how circulation actually happens. Tomorrow we're going to talk more about what happens with the veins and arteries. We're going to talk about veins and arteries. Okay, so the cardiac valves. What is there? You have 4 main valves. What is their responsibility? To let blood pass through and to prevent blood from regurgitating or coming back from where it came from. It also helps blood be ejected or moved from one place to the other. So when the heart contracts, the bicuspid and tricuspid valves shut. When the heart contracts, when the heart relaxes, they open up to let blood flow through. And when the tricuspid valves are closed, your semilunar or your pulmonary artery vein and your aortic valves are open. So blood moves consistently. And think about this, from the time you're about 18 weeks in utero, which means that in the second trimester, after the first trimester, your heart starts beating of pregnancy, and it never stops as long as you're alive. If your heart stops beating, everything stops to function. So it's a muscle that is strong and that is very important because it keeps us alive, obviously. So there's another image of the arteries and veins and all of the chambers as well as your valves. And that's a better image of the valves. A tricuspid valve is called a tricuspid valve because it has 3 flaps. The mitral valve or bicuspid valve is called that because it only has 2. It has 2 flaps that open and close. All right, guys, that is it for your cardiac or the heart. Be sure you take good notes and make sure that you know the flow of blood through the heart because you might have a quiz tomorrow over it. All right, everybody have a great day, and I will be back with you tomorrow. Thank you so much.